The JVP is the highest point of oscillation in the internal jugular vein, or alternatively the point above which the external jugular vein appears collapsed. The JVP is usually measured in the vertical distance above the sternal angle, the bony ridge adjacent to the second rib where the manubrium joins the body of the sternum. Steps for measuring the jugular venous pressure. Make the patient comfortable. Raise the head slightly on a pillow to relax the SCM muscles. Raise the head of the bed or examining table to about 30 degrees. Turn the patient's head slightly away from the site you are inspecting. Identify the external jugular vein on each side, then find the internal jugular venous pulsations. Focus on the right internal jugular vein. Look for pulsations in the suprasternal notch between the attachments of the SCM muscle on the sternum and the clavicle, or just posterior to the SCM. Distinguish the pulsations of the internal jugular vein from those of the carotid artery. Identify the highest point of pulsations in the right jugular vein. Extend a long rectangular object or card horizontally from the point and a centimeter ruler vertical from the sternal angle, making an exact right angle. Measure the vertical distance in centimeters above the sternal angle where the horizontal object crosses the ruler and add to this distance 5 cm, the distance from the sternal angle to the center of the right atrium. The sum is the jugular venous pressure. Press just inside the medial border of a relaxed SCM muscle, roughly at the level of the cricoid cartilage. For the left carotid artery, use your right fingers or thumb. Never palpate both carotid arteries at the same time. This may decrease blood flow to the brain and include syncope. Slowly increase pressure until you feel a maximum pulsation. Then slowly decrease pressure until you best sense the atrial pressure and contour. For the cardiac examination, stand at the patient's right side. The patient should be supine with the upper body and the head of the bed or the examining table raised to about 30 degrees. Careful inspection of the anterior chest may reveal the location of the apical impulse, the ventricular movements of the left-sided S3 or S4. To palpate heaves and lifts, use your palm or hold your finger pads flat or obliquely against the chest. For thrills, press the ball of your hand firmly on the chest to check for a buzzing or vibrating sensation caused by the underlying turbulent flow. In a quiet room, auscultate the heart with your stethoscope with the patient's head and upper chest elevated to 30 degrees. Start at either the base or apex. Listen first with the diaphragm, then with the bell of the stethoscope. The apical impulse represents the briefly early pulsation of the left ventricle as it moves anteriorly during the contraction and contacts the chest wall.